Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, March 19th, 2021. Well, right now, cases are more or less moving as they have been. Worldwide, we saw about 3 million new cases, which is about the same as we were at the week before. Things are generally around the world either staying level or upticking a little bit. Here in the United States, things are declining, but very slightly. We saw 390,000, which is 40,000 fewer than the week before. Sounds like a big drop, but not compared to where things actually stand. Here in Massachusetts, it's more or less holding steady between 10 and 11,000 new cases, roughly the same as last week, perhaps even slightly more. Deaths, however, are continuing to trend downwards with about 58,000 new deaths worldwide, 6,000 fewer than the week before, around 9,000 new deaths in the United States. It's about 1,000 fewer than last week. And here in Massachusetts, we lost 208 people to COVID-19, about 47 fewer than the week before. When we look at the trends, you can see with still some numbers thrown off by a backlog data release about 2 weeks ago, there is still a general downward trend, but the slope has reduced significantly. We're not getting anywhere near the type of reduction we used to see back in February. When we look around the country, just in the last week, this is showing the rates per 100,000 people. The Northeast is still seeing the heaviest cases by population, which is unfortunate. I don't know if that's due to any specific policy difference in the New England area, or if that has to do more with the fact that it's been cold here and it's harder to move things outside when it's cold. When we look at hospitalizations, that also seems to be kind of plateauing as well. It is still significantly down, coming down noticeably week over week. 4,000 fewer hospitalizations is something that does make a difference if you're working in one of those hospitals in terms of the amount of resources that are available for any individual patient. But again, we are still not significantly below our numbers in, say, August, and there's a point of around a little over 20,000 hospitalized patients that we've never really broken. We've never gotten below that level since basically the beginning of the pandemic. When we look at deaths, though, continuing to trend downwards there, so this hasn't plateaued yet. It may soon, as the other indicators, cases and hospitalizations are. This will go a little bit later on that, of course, and we are still seeing around 1,000 people a day dying of COVID-19 on average, which is still quite a lot. But hopefully that will trend downwards continually, though, because vaccines are going to make a bigger difference on that scale than they are in any of the others, certainly. And as the older, more vulnerable population is vaccinated first, hopefully this one will continue to trend down instead of plateauing like the other metrics. So let's look at a couple of developments in this last week. First up, the US has agreed to supply Mexico and Canada with some of our excess vaccine. This is largely AstraZeneca vaccine that has yet to be approved here in the United States and has been sitting in warehouses for some time. So we're going to send several million doses north and south there to places that have approved the AstraZeneca vaccine, though we may actually see an application for emergency use authorization from that vaccine ourselves shortly. However, it looks like we should be pretty well covered with the 3 we already have. Also, FEMA has announced it is going to start reimbursing families for the cost of COVID-related funerals going back through the last year. This will probably make a big difference to a lot of people who, in addition to losing a family member, also had to eat the cost of a funeral, which is remarkably expensive, even when there isn't an actual gathering for it. Finally, the EU has restarted using the AstraZeneca vaccine. Their medical advisory committee has determined that it is safe. There's no increased risk of blood clotting, and they should begin vaccinating with the AstraZeneca vaccine shortly, though that may vary from country to country. For the sources from this report, you can find them at New York Times, the raw data, mass.gov for Massachusetts-specific things, and CDC for the charts and graphs. For more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.